So, another thing that I would really love to talk about is you have any condition at all, but then if you're like me, you probably want to keep it to yourself. You don't want to talk about it. You just want it to be there. If anyone gets to find out, fine. If they don't find out, it's just the way it is. But I have come to realize how dangerous that is. I don't live alone. I have a housemate, and we are in that house together. We're friends. But sometimes 3 days or 4 days we have not really seen each other, but we both know that we are inside the house. Can you see how absurd and weird that is? We wake up at different times, we do our things at different times. We don't go to the same hospital, so we don't get to see. When I return for the day, I just love to take my bath and stay in bed. When I came across that patient in the hospital who had a stroke and no one knew he had a stroke, I started thinking, so maybe one day I could actually be inside my room, have a stroke, and my housemate wouldn't know. He would just assume, okay, he's sleeping as usual. Do you see how dangerous some of these things are? Now, everything has advantage and disadvantages. There's an advantage of having your own privacy, doing your own things, not having to be disturbed, or you not disturbing someone else. There's an advantage to it, but also there's also a disadvantage. Now you have to weigh the two and know what is important for you and what's not. Now, if you have certain diseases that requires you to always need help, there are some things you cannot do. For example, you can't sleep with your door locked. Again, still having this conversation with my friends, someone died in his room and the housemate was there. And now I started thinking, many of us love living alone. Nothing wrong with that. In fact, you avoid a lot of troubles and a lot of discomfort. But when you have certain conditions, it is more advisable not to live alone. I am not saying you should not live alone. I'm only saying it is not advisable to live alone, knowing that at some point you're going to need help. You don't expect people to be moving back and forth whenever you need help, or probably you have something that you need attention for a whole lot of time. These things are tricky. Sometimes you have to sacrifice some things for other things to be balanced. Some things you have to make priority consciously. There are some things that you have no choice. You just have to make them part of your priority. I don't know much. I talk based on the things I see, based on experiences of the people I meet, based on discussions I have, and based on how I see patients and I see the trouble they go through. I see families go through a lot for their loved ones, in words, in theaters and stuff. And it's sad that some of these things have to happen. It's sad that some of these things, we can prevent them, but we rather wait till it gets bad, then we try to cure, which is even more expensive than preventing. I'm sure you're having a nice time.
Hello, my name is Philo. Welcome to my video.
Yay! Peace out. Mwah.